Hello again, my fellow YouTubers. Welcome to episode 4 of Anxiety and Depression Adventures. This time we're focusing on how to get to the right doctor or physician. And this is one which probably varies dramatically depending on where in the world you are, particularly North America. So, as always, I'm going to share my personal experience with the whole thing, the upside and the downside. As any of you who have been watching these episodes knows, about a dozen years ago, I was diagnosed by my family physician and subsequently by psychiatrists as having generalized anxiety disorder, coupled with periodic times of depression. So my time with the mental health side of our health system was really one of learning and one of great frustration and one that I wish I knew then what I knew now. I can tell you that much. So let me walk you through it very briefly. As I said in my previous videos, if you are of the belief that you have an ongoing sustained level of sadness, anxiety, self-doubt that did not pre-exist, definitely go to your family physician. That's your typical starting point. And I won't even go down the road as to whether or not you have or haven't a family physician you can go to. Or go to a local community-based mental health center, which most larger regions do have, one way or the other. Get seen, get assessed, and hence start your adventure down the path to feeling better about yourself and being able to contribute to your own life, your family, and to work and whatever else you care about. Anyway, so here's the thing though. You get in with your family physician, and as I've mentioned, a lot of family physicians in my area have very disproportionate caseloads or patient visits that are mentally health related or mental health related, particularly depression and anxiety. So they're fairly well versed in it, which on the one hand you would think is a good thing, and I think for the most part it is. On the other hand, if you're like any of us in any role, if we're faced with the same type of symptoms over and over and over, you can sort of fall into a cookie cutter type of mode where it's like, okay, you're due for this dose of Ativan, and we're going to give you some, Paxil to go with it, and oh, by the way, make sure you get lots of exercise, and I'll see you in a month. And that becomes a standard for a lot of people. Now, that's all well and good, and the mental health side of our overall healthcare system is not overly endowed with resources, just like none of our healthcare system is. So the family physicians know they just can't be passing everybody off as a referral to a psychiatrist. It'd be nice if they could, but they really can't. And because they have a certain comfort level with this stuff, they probably feel quite comfortable handling it themselves. The problem is, where should that handoff occur between your family physician that maybe you've known for years and that individual determining, you know what, we've been working on this for 4 months together, and now I need to bring in an expert in this field and make a referral so that you are seen by a specialist who can objectively look at what you have been prescribed, how you've reacted to it, how your overall sense of well-being is, whether you need to be hospitalized, whether ECT, um, you know, they still do it today. I've had it done to myself as well. Shock therapy, for lack of a better phrase, needs to be administered. So these are things that there does come a time and a place where you, without even knowing it, may be faced with a well-intentioned family physician that's hanging on to you and not referring you on to more specialized help quick enough. This happened with me. I spent 2 years with my family physician, a good chunk of it almost with weekly visits, tweaking the meds, taking me off meds, flushing me out of meds, and so forth. And I started asking the question, maybe I should see a psychiatrist. Now, I mean, this guy, you know, started treating my children when they were born, so I knew him rather well, and I didn't want to hurt his feelings, but, you know, he was kind of a rough and ready kind of doctor anyway, so it's like, well, you know, he said lots of stuff to me over the years that kind of rubbed me the wrong way. I don't think I'll be too delicate with him, and not doubting him, but just kind of saying, you know, haven't we gone far enough here? So I did get a referral to 2 or 3 psychiatrists. But my family physician was very vocal about his opinion of how good these psychiatrists were. And in a publicly funded healthcare system, unfortunately, we don't get the pick of the litter. We get whoever is available. And my doctor's opinion was the people that are available and are taking on patients are not the good psychiatrists. And the ones that have a 3-year waiting list to get in to see, they are the good psychiatrists. So where would you like to go? Very frustrating scenario. I went to one psychiatrist for a few visits, and she came back with a diagnosis from my family physician that he basically rolled his eyes at and tore up right in front of me, that said I was narcissistic and basically keep him on Paxil and clonazepam for the rest of his life, which I was already on. Gee, that was worth a lot of effort. Then I saw there was another psychiatrist in another city that he sent me to. And by the way, each of these events were only happened because I pushed. I said, look, I think I need to see a specialist in this area. So I traveled an hour and a half to a city away from me. Sat down with this, you know, very smart, nice psychiatrist. I barely got maybe 5 minutes worth of a description of my anxiety symptoms out of my mouth. And then she spent half an hour telling me about this research project she was doing on the effects of glucose in people's diets, and how she and a couple of other professors at a couple of universities in North America were exploring a theory that actually gluten can not only be a digestive problem, but also can affect your mind and the chemicals in your brain. So she sold me some very expensive food supplement powder to flush out my system from any sign of gluten. And for the next month and a half, even once I started mixing in real food with her milkshakes, well, actually I mixed it with tomato juice to make it taste good, and actually it didn't taste too bad, and I lost quite a bit of weight. But nonetheless, the next time I saw my family physician, he told me quite frankly that he was shocked that that was the route that she took, that one of the main rules in medical school that doctors learn is that you never, ever apply your research to your patients as if they're all equal. You assess them individually and then decide whether or not you should go with a conventional method, an experimental method, explain the pros and the cons, blah, 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 blah. So, yeah, I had some very interesting visits, but nonetheless, it was worth doing and exploring, because trust me, when you feel as crappy as you do about yourself, when you're living with virtually consistent high peaked levels of anxiety like I do, you'll do anything, believe me. Anyway, as I mentioned in the previous video, unfortunately, just over 5 years ago, my marriage fell apart, and being self-employed at the time and not really having a ton of money, I wound up moving back in with my mother in another city, and close to my children, but still an hour's drive away. And I continue to live there today. So once I arrived here, I no longer had a family physician. I no longer had any mental health support whatsoever. And just on a fluke, my mother spoke to her family physician, who said, "We do have a mental health center here in this city." And this is the first I'd even heard of a mental health center. So of course my first question was, why didn't my family physician refer me to my previous city's mental health center, which, oh, by the way, had always been there? So that sort of annoyed me to some great degree, but the poor man had died in the interim, so, I'm not going to speak ill of the dead. I went to this mental health center. They got me immediately set up with a series of talk therapy appointments with a social worker, and also pretty lickety split in with a very sharp psychiatrist. And now I have a second psychiatrist out of the same facility that I work with, and a new family physician. So the whole ball of wax changed when I came up here and to this municipality. And I was so thankful for it. They basically started me from scratch. They tried different methodologies, different medications, and so forth, and really having access at the same time both to someone to talk to delve into my childhood and my past and what my siblings have been through and my family history and that type of thing, participate in group activities or sessions that they hosted at the mental health center. There was a wide variety of resources available, and I basically live in the same jurisdiction overall as the other city that I was in. So why didn't my family physician way back when, 5, 6, 7 years ago, suggest some of these resources to me? It's beyond me. I know he was trying his best, but he was just throwing the pharmacy at me more than anything else. Anyway, all of these things have been extremely helpful in unison together. So it really brings me back to the fact that in retrospect, now that I know these community-based services are out there, you may have a doctor who's quite familiar with this stuff and openly offers it to you, and I desperately recommend to you to go grab it. What harm could it possibly do to you to go attend an evening session, a group therapy session, or to speak one-on-one with a social worker, or better still, a psychologist, to get a psychiatrist who is a specialist in the medications and the side effects and the dosages and all this kind of stuff, who can order a blood test to see, how these different levels are affecting you and all this kind of great stuff. So, take advantage of this sort of thing. It is out there. I don't care if you're in the States or in Canada or Mexico or wherever. I'm sure somewhere you live close enough to a place where this stuff exists. So you may unfortunately have to go hunting for it yourself. You may have to ask for it yourself, but don't be shy. It's your life. It's your health on the line. It's the happiness of those around you as well that is on the line. So, don't just look at your family physician as being God, the be-all, the end-all, and only what he or she says is what you're going to do. If you feel that you're not being offered a spectrum of options, then ask. And if you don't get the responses you're looking for, then Google it for your community. Just type in mental health and, dash whatever city you live in. Look in the yellow pages, the white pages of your old phone directory. Trust me, it is there. And I don't care what your financial situation is. A lot of these places do have programs for those that cannot afford to pay. I'm one of them right now. My psychologist is not charging me a dime. And normally it's $125 an hour. Well, not even a full hour, 50 minutes. So the tip of the episode is, yes, get to your family physician. Yes, follow their initial advice. But bear in mind, if you had a cardiac problem, how long would you expect your family physician to hang on to you? A month? 6 months? A year? And still have very life-impacting symptoms? Think about it that way before you open your mouth and say to your doctor, Doc, I think it's time that you send me to a specialist. I want to see a specialist. You're either paying for it or you're part of a government Medicare system. Either way, you're well entitled to do that. And trust me, it's not going to hurt their feelings. They probably get those requests all the time. And they're not trying to do you any ill will. Trust me. They think they're doing the right thing for you. But it is your life. And unfortunately, in the mental health zone, and this probably applies to other zones of Medicare, you do have to take some level of responsibility for your care. And if you get the suspicion it's dragging on a little too long before, they suggest some other options that I've already discussed that are well available to you, then open your mouth and ask. And if you hit a brick wall, then go look yourself. And you will find people out there. None of it's a magic bullet. None of it's going to fix you overnight. Nothing's really wrong with you in the sense you need to be fixed, but I know how desperately you want to feel better. You want to feel a sense of happiness, that spark to get up out of bed in the morning and go to whatever it is you do and enjoy your day and enjoy the people around you and love your kids and love your parents and your siblings or whatever. And there's so much joy out there to be had. Don't let someone else's stubbornness get in your way. So hopefully this doesn't apply to most of you, but I felt it was something very worthy of an episode unto itself. So there's your tip. There's a little bit more about me, and I hope you all have a fantastic day. Take care. Be well.